Hello, I'm Dr. Sabnam Parvin, consultant in reproductive medicine and surgery in Genome Fertility Center. And today we are going to discuss which is more important, the egg quality or the egg quantity. Before we start with the topic, let us go through a very basic concept. So, when a female baby is inside her mother's womb, all her eggs start developing. And once she's born with a finite number of eggs. After which, after the birth of the baby, the eggs cannot increase in number. So many a times the patient comes to us and asks as to why their egg count has decreased and whether it is possible to increase the egg count or not. So once the eggs are formed, after birth, it just keeps declining. So there is no medicine or there is no method by which this egg count can be increased. Now, what happens is with every cycle, a number of eggs they are recruited, and from there, one of the egg that ovulates every cycle, and that's how the menstrual cycle goes. After the age of 30, the egg count rate decreases, and the number of eggs that are recruited, these are more, and so the decline starts increasing more and more. By 35 and after 35, the decrease is more. Finally, at 40 or early 40s, the number of eggs that are found are very low in number. Now, along with the egg quantity, the quality is also affected with age. So, with age, the egg aging takes place. Due to the aging, the energy content of these eggs they decrease. Sometimes there are certain genetic abnormalities which are found in these eggs, and therefore, with age, the number of miscarriages, the chance of miscarriage increases, the chance of having a live birth decreases. This is because of the various changes that the eggs go through, and this is because of the decrease in the egg quality. Now, when it comes to a woman, the number of eggs or the rate at which it is decreasing, it varies from person to person. So there are many couples, because we are a tertiary center. So there are couples who come in with a history of irregular cycles, or maybe there is no such history. There is just they are trying to conceive and they're not being able to do that. And when we do an ultrasound, we see that the egg count is low. So the number of eggs a woman is born with, or the rate at which it is going to decrease, it varies from person to person. Sometimes it happens that because of genetic reasons, because of environmental factors, or unknown causes, this decline or the initial amount of eggs is less. So due to which the at a very early age, say around late 20s or early 30s, the egg count decreases to a lower extent. This is usually known as premature ovarian insufficiency. When such couples come to us, they come with sometimes an AMH report which is lower than 1, or there is an increase in the FSH hormone levels, or when we are doing an ultrasound, we see that the egg count has decreased. Now, there is another group of patients where we see that the egg count is fine, but still the patient is not being able to conceive. In such patients, when we try to stimulate these patients with some drugs, oral drugs, or hormonal injections, we see that all the eggs that are supposed to grow in an IVF cycle, they fail to grow, and only a handful of them are will reach the maturity. And when the pickup process takes place and we see the eggs under the microscope, we find that the egg quality is also not that good. So these are those group of patients where the egg quality is fine, but the egg quantity is fine, but the egg quality and its response is not good. This is again, it could be because of some autoimmune disease that they are suffering from, or some genetic factors or environmental factors. Most of the cases we are unable to pinpoint as to the cause, but with times the egg count in general has been shown to decline. Now, what are the treatment options in such patients? So, first, in those patients where the egg count is fine, the quality is affected, or the response is less, in those patients, we see that sometimes it could be because of certain genetic problems like polymorphisms and everything. So, in these patients, we can increase the dose of the hormonal injections, and in that way, the response can be better. Or sometimes we see that even with higher dose injections, it's not working, then we can go for with adding of HMG or LH injections. So, these are ways by which we can improve the response. Now, the egg quality, to improve that, we can give certain antioxidants, oral antioxidants, certain energy producing substances like the coenzyme Q10. So, these are commonly given along with the stimulation cycles. Now, in case of those patients where the egg count is low, young patients as well as the old patients, in them we can stimulate these patients with a higher dose of hormonal injections. And even after that, if the number of eggs retrieved is low, then we can do multiple stimulations and we can get a good pool of embryos. Those we can take it to the blastocyst stage, and from there we can go for sometimes, if necessary, we can also go for genetic testing, and only the ones which are genetically normal, then we can transfer in these patients, and that improves the chances of pregnancy. Now, for some new treatments have come up, like the PRP treatment, where they say that they are going to rejuvenate the ovaries and the ovaries are going to start producing eggs again. But the results in such cases are very dicey, and the chances of it going to the live birth is also less. There are certain drugs, oral drugs, which have been used, like the dehydroepiandrosterone or the testosterone hormone, which improves the recruitment process, and maybe the antral follicle increases by one or two more follicles. So these are therapies which can be given before a stimulation cycle or before we are going for an oral medical management. So, to conclude, both egg quality and quantity, both are important. And sometimes it happens that even if the quantity is fine, the quality is not that good. So, if that is the case, then ultimately the chances of having a good embryo or the chances of conception decreases. If you have any questions related to this, you may write it in the box. Thank you.